Do you sometimes feel unusually tired or notice small, painful lumps in your neck? Maybe you've had flu-like symptoms that just won't go away, even after resting. These might seem like common issues, but they could be signs your body is fighting a quiet infection called toxoplasmosis. Imagine you're a mom-to-be eating a warm sandwich with undercooked meat, something you've done for years, only to find out later it could affect your baby's health. That's the silent risk of toxoplasmosis. Most people don't know they have it, yet it can quietly impact lives, especially unborn babies. Let's explore how this sneaky parasite works and how to stay safe. So what actually causes toxoplasmosis? Think of a tiny invader so small you can't see it, called Toxoplasma gondii. It's a parasite, which means it lives inside other living things to survive. You might get it from your cat if you clean its litter box and don't wash your hands. How the cat can pass the parasite in its poop, and if that gets on your hands and then into your mouth, boom, infection. Or picture slicing raw meat on a cutting board, then using the same board for your salad, without cleaning it. Another way the parasite sneaks in. Even garden soil can be risky if a cat used it as a toilet. So it's not just about cats, it's about how careful we are with food, hands, and everyday habits. Now, what does toxoplasmosis feel like? If you're healthy, you might not feel anything at all, like having a virus and not even knowing. But some people say, I felt swollen glands, like little peas under my skin, and was so tired I needed naps every day. Others had fever, headaches, or muscle aches, just like the flu. But for unborn babies, the story is scarier. Imagine a baby being born with eye infections, hearing issues, or even learning delays because the mom caught the infection during pregnancy. Some babies don't show signs at birth, but problems appear months or years later. That's why understanding symptoms early is so important. How do doctors find out if you have toxoplasmosis? They don't just guess, they test your blood. Think of it like checking your car's oil. The test looks for signs that your body has seen the parasite before. If you're pregnant and at risk, your doctor may run a blood test to check for antibodies. For babies, they might test the mom's blood during pregnancy or do special tests after birth. If someone is very sick, like with swollen brain or vision problems in one eye, they might need brain scans or eye exams too. Treatment: healthy people usually don't need medicine, their body fights it off. But if you're pregnant or have weak immunity, like with HIV, doctors use antibiotics, like a double shield of medicines, pyrimethamine and sulfadiazine, to protect you or your baby. The key is catching it early. Can you avoid toxoplasmosis without giving up your cat or steak? Absolutely. First, wear gloves when cleaning the litter box, or better, ask someone else to do it daily. The parasite isn't harmful right away. Second, cook meat well. Use a thermometer to make sure it hits 160 degrees Fahrenheit, 71 degrees Celsius, so no pink inside. Third, wash fruits and vegetables, especially if they're from soil that animals might have touched. And always wash cutting boards and hands after handling raw meat. If you're pregnant, skip changing litter, gardening without gloves, or eating rare meat. Think of these steps like seat belts. They don't stop every risk, but they lower your chances of trouble. Wondering if science is winning against toxoplasmosis? Yes, researchers are working on a vaccine. Imagine a shot that could stop the parasite before it starts, especially for pregnant women or people with weak immune systems. Scientists are also studying how toxoplasma affects behavior, like making rats less afraid of cats. Crazy, right? And if it connects to mental health in humans. New blood tests are becoming faster and more accurate. And gene editing tools like CRISPR are helping study the parasite better. These advances don't just help treat sickness, they help us understand how tiny